and welcome to the GHA GDDS User Group conference call. All lines are now fully interactive. Please be aware that any background noises, conversations, or placing your line on hold will broadcast into the conference. Please utilize either your phone's existing muting function or via touch-tone phone. You may press 6-1 pound to mute and 6-0 pound to unmute. Please also note that this call is being recorded. I would now like to turn the conference over to Leslie Sainovich. Please go ahead.
Thank you very much, and good morning, everyone. I hope everyone's enjoying what looks like it's going to be a beautiful spring day here in Atlanta. We have quite a bit to go over today, and I've got here with me Bill Wiley, our Senior Vice President of Business Operations, and Sharifa Navos, our Data Integrity Specialist. Can everyone hear me okay?
Yes.
Yes.
Yes. Yes.
And can everyone see my screen?
Yes.
Thank you. Well, we'll get started then. Our agenda is similar to every month. We're going to briefly go over the overview of our data program, the data submission schedule and publication. We'll give you an update on the readmission module that is being funded by the State Office of Rural Health. And then also we will give an overview of our data services portion of the GHA website and some new reports we have out there and some upcoming webinars that are going to be available. And then, as always, we will have some open forum time for questions and demonstration on the GDDS strategic planning module. So feel free to jump in anytime with questions or requests for us to show you something. As always, I like to give a quick overview of what the Georgia Discharge Data System is because we are constantly adding new users. The Georgia Discharge Data System is our data program where hospitals submit their inpatient and outpatient discharge data. That data is submitted in the UB04 data format to our vendor, Heidi, and that is then processed. Different geographical codes, MSDRGs, are assigned to that data. The data is also run through a series of data checks, which are then made available to you in edit detail and verification reports. After all the checks kind of have been programmatically made, our data integrity specialist, Sharifa Navos, also does manual visual data review to make sure it passes the logic test. And then that data is released and becomes the Georgia Discharge Data System. We are collecting that data monthly and releasing it quarterly into our tools currently. There is some plan to move, especially for the readmission module, to move to a monthly release. After that data is released to the Georgia Hospital Association on your behalf, we also submit that data as required by law to the Brain and Spinal Trust Fund Commission, the state of Georgia, and then we also participate in a couple of programs for research purposes on a national platform, the Agency for Healthcare Research and Quality and the Healthcare Cost and Utilization Project. We also release this data for some facilities. It's called the Limited Data Set, that is a subscription-based product. It is the complete inpatient and outpatient de-identified patient-level database that some hospitals or systems subscribe to. That is released on a quarterly basis and is available for $12,000 per year. And we do have historical years available. Just for your information, we will be releasing the first quarter of 2019 pretty soon, and so those limited data set order forms will be going out to those currently participating in that program, and if you have an interest in that data set, just please let me know. And the purpose for that limited data set is for facilities to have a little bit of a deeper dive into the patient level. But again, it is de-identified to load that data set onto a SQL server or a much larger database that would platform that would be able to handle that data to run your own internal reporting. But in turn, as part of your participation in the data program, that is why we provide the visualization tool, the JVON tool, so that you are able to run your own reports without, having to have the burden of loading that large data set onto your system. At this time, because we are currently, working towards closing out the end of 2018 data, that database data set will be closed most likely at the latest by the end of July and made available in August to users. And once we close that database, no additional updates will be able to be made by facilities. So Sharifa's been working diligently to review the data internally to make sure if there are any red flags or missing data or inconsistencies that she contacts hospitals to have them review their data and resubmit if that's appropriate. But I'm going to let Sharifa just give you a quick overview about what reports are available for you to review your data and how you would go about doing that. Also, if you're not aware of who is reviewing your data, please let us know, and we'd be happy to work with you to identify, one, who's uploading your data, and two, work with you on trying to identify the people appropriate in your hospital or team to review that data. It may be the people that upload it, but it may not be. So we need to make sure that you have one, people that are uploading the data, making sure it's successfully uploaded, but then after the fact that they are reviewing the data that was uploaded and processed to make sure that it is complete and accurate. So Sharifa?
Well, thank you, Leslie. Like Leslie said, the data has to be reviewed, especially 2018, before the closure in July. So for those of you who have access to the HIDNet website, should be familiar with this image right here, where this is under the Reports tab, where it shows you your verification report, and that's a PDF that's generated every time the data file is submitted. And so it used to have about 8 pages, now it has about 14 pages, so it kind of gives you an overview of your discharges and then doing a comparison with the previous year. So as you can see there, you'll see 2017, 2018, the discharges, your charges, for inpatient and outpatient procedures, and the red numbers are usually a deviation. It might be slight, so you might have to just look at it and see if it fits into what your actual discharge numbers were. But if it is a big margin, usually I'll contact you if I see it, but we do recommend that you look at that and see, why the data is the volume is either too high or too low. And so another page separates it by patient type, and so that's where you look at your inpatient, swing bed, and then for the outpatient, it'll be ambulatory, surgery, emergency room, and others. So you just look at your distribution compared to previous years and make corrections as needed. And if you have any questions or want to see anything deeper, you can always contact me, and we can work with Heidi to provide you with like a specialized report or something if you want to see what's going on behind all this. Here, another one by primary payer, and that's for inpatient and outpatient as well. And you can kind of glance and look at the distribution, look at your numbers for each month for 2 years. Same thing here. And this is for outpatient, yeah. And I'd like to, again, just make sure that the people who are reviewing and submitting the data familiarize themselves with this report, because it's really helpful in finding major errors, and then you find them. I guess since we're submitting monthly, the sooner you find them, the better, because then you can just go in there, change it before the next release, and your data will be clean and valid, for the database. This is towards the end where it separates it by admit type, which is if it was an emergency, a newborn, trauma, point of origin, where they came from, and then, of course, demographics. So you have the patient's gender, the distribution of that.
And Monday night I noticed
and then the patient's disposition, which is where they're going to go to after they get discharged, where they're going. So most people go home, and then you have other categories there. And again, another demographic, the patient's race and ethnicity, I think, is also included in that. And they've added a few more pages for frequency of the top 250 zip codes for inpatient, so basically where the patient is coming from. That's something that people like to see, just to, I guess, to see where their population of patients is coming from, what zip code, what county. And here they have it by DRGs. For those of you who like to see that too, when you do a more thorough review, and then attending physicians, which you'll see the physician name. We just didn't put it in there right now, but for your particular facility, you'll see the name. And this is for outpatient. And so this is another report. This is the edit summary report, which you'll receive, the data submitters will receive every time you submit your data file, and you'll get it in your email, and I'll get a copy of it too. And this one shows you your fatal and warning errors. And of course, the threshold is 3%. So once that percentage goes up past 3%, it'll be in red, and usually I'll contact you to see if you can make corrections, and then you can go to the edit detail report, where you'll be able to see the patient's information, the medical record number, so that you can go into the chart and make the correction first in your system, and then you would extract a new file, delete the old one in HIDE, and upload a new file. And so this is another example of how many fatal errors there are. So this one is at 0.22%, so it's well below the threshold, so it's a good, clean report. And again, the edit detail report, so this is what the second page would look like in the edit detail report, showing you the patient's information, birth date, so that you can find it easily in your facility system and make the changes. And that was really it. Again, I encourage everyone to look at their verification report for 2018 and clean that up, clean the data as much as you can, and I'll be reviewing stuff too, emailing you, and we can work together to make sure we have some good data before we close the database. Are there any questions?
Any questions for Sharifa about reviewing your data submission?
Sharifa, this is Tanya Chitwood from Stevens County Hospital.
Yes.
We noticed actually quite a few months back that our codes were not matching up for our race of patients, and we have since changed that, but we have been going through manually on our reports when we're doing our data abstraction and changing that race. Is there something I need to do as far as giving you corrective numbers on that?
Yes, Tanya, that would be great, and thank you. That's a good example of exactly why we want you to review the data. So Sharifa will take a look at that and get with you about what timeline of data that needs to be refreshed. And what you would do is on the HIDE portal, you're able to go in and delete a submission, and then you can upload the corrected submission for a particular timeline and whether it's an inpatient or outpatient file. But Sharifa will be glad to work with you on that. And in HIDE, you can track all of your submissions, and it shows you the timeline from when, the timeline that you uploaded, when you uploaded it, and what the date range of that particular data upload was. So yes, we can pinpoint what data needs to be replaced or refreshed, and that's exactly why we leave the database open until the end of June, beginning of July, so that we have as many corrections and updates and complete data as possible for the previous year's data submission.
Okay.
Any other questions?
One more question. in an average year, like how correct and complete would the data be at this point versus, say, in July? Is there going to be significant changes overall? Say just in an average year. I know you won't be able to say this year in particular.
That's a good question. Since we have moved to the monthly data submission, we feel, I believe, that the data has become more accurate faster because hospitals are reviewing their data, not just on a quarterly basis, but they're reviewing it on a monthly basis. So at this point of the game, barring some facilities who have had billing software changes or billing vendor changes where there could be some drops in volume or inconsistencies or coding changes, we feel like, the data at this point is in pretty good shape. Sharifa, you've been reviewing it. What is your feel for it?
Yeah, I did notice that. So the monthly submission has helped for us to catch things earlier so that you can resubmit it and then, it gets refreshed every month. So the data is getting better, is looking better. And I would, if there are any issues like what Tanya said, if you did notice that you weren't including the ethnicity or the race in your data, then it's always good to refresh the whole year. You can do that. You have time to do that and submit it by quarter into the system, and then you will see an improvement in how the data looks. So the numbers will be better, the volumes and the distribution will be better as well.
And I will say in the last really 2 years since Sharifa's joined our team that someone reviewing the data on a daily basis. Back in 2015, when I first began really working with the data submission, we were at this point of the year and we still had facilities who had not submitted any data for the year, some smaller. But, we are on top of this every single day, and the data is more complete, it's more accurate. Bill, do you have any thoughts?
I think just reviewing it in smaller chunks has allowed us to identify issues before they aggregate over the course of the year. So I guess that's a long-winded answer of saying we're more confident with the quality of it at this point, knowing that we've collected all through the full 2018 this year than we have in previous years.
All right. Thank you.
Any other questions about the GDDS data set and submission? All right, well, we're going to move on to readmissions, and Bill is going to share with us just a little bit about the tool is live. We have an initial group of users.
Yeah, and they're right now kind of stress testing it for us. We've got a couple of comments and questions back that we want to kind of discuss through with the entire group, too, about the way we've identified. And this tool is not related to Medicare quality programs. This is a strict, was the person readmitted? So this is more of a quality tool versus a way to look for penalties or anything like that. We don't make any sort of judgments in here about whether it was a planned or unplanned readmission. It was simply, did the person show back up at a hospital or in a different facility within 30 days? I don't think it's showing.
I was trying to toggle over to, I was trying to toggle over to the actual website, the readmission tool. On the first tab of that tool is a README tab, and that gives a little more detail that may be helpful to you. Once you click on this readmissions overview, there's a README tab, and it gives a little more specifications about what is being calculated. So I just thought we'd bring that up. We had a couple of questions about, are swing beds included? Should they be included? And we thought it'd be helpful to point out that we didn't, as Bill mentioned, we didn't really program this to any kind of penalty program or quality measure. It's just we're trying to help hospitals monitor patients that are being readmitted and why.
Do we have anybody that's kind of in that initial group that's on the call today? I know it's spring break for about 60% of the state, so hopefully not. hopefully they're sitting on a beach somewhere.
Hey, this is Cheryl at Peach. I had the question about the swing beds, so that's good to know. But is there a way that you can exclude swing beds so that we know, because we have such a high swing bed volume that it totally skews our numbers?
Let us talk offline.
Let's look at that. That's not
Cheryl.
something we really anticipated, and I bet you that it is calculating it as a readmission somewhere. I bet it's calculating swing bed as a hospital bed, not as like a
Right.
A rehab.
Looking at the numbers, it definitely is.
Okay. So we'll take a look at that.
This is Tanya.
How it is.
Stephen
Yeah.
County.
Cheryl sent me a detailed email that I've forwarded on to the programmers to look at, but we will look at it again as well, Cheryl, to see what we can figure out.
Thank you so much.
You're welcome.
Wonderful. I'll have to look at that by discharge classification then.
Mm-hmm. Patient type.
Yeah.
Mm-hmm.
Mm-hmm.
Any other?
That's a good catch, and that's why we're glad that you were able to take a look at that for us.
Leslie, this is Tanya Pitwood again at Stevens County. We have a new swing bed unit that opened in October of 2018, and I really wasn't sure that it was going to show up and be part of this on the HIDE report under readmissions. I never really even thought about that. I might need to have somebody look over ours with me as well, since this is new.
Okay,
we'll
great.
Look at it. Yep, we'll definitely look at that.
Okay, thank you.
Yeah, because we didn't make any, even in the calculation, we didn't make any kind of value judgment on, even the type. So if it was coming back to a, quote, hospital, it's probably being counted in there.
Yep.
I bet, does when it does it, and this is just something that popped in my head, does it show you have an excessively high number of readmissions in that 1 to 7 day category?
Yes, like 80%.
Okay, that's exactly what it's got to be then.
Yes.
Yep. Because it's technically a discharge and then another admission in that step-down type unit. So, yeah, that explains that. That's easy enough to have them look at.
Yep.
Good catch. Good catch.
Anybody else No problem. Anybody else using on the line that has been in the readmission tool and has any feedback or questions?
Well, as soon as we get these little bugs rolled out, we're gonna have it for everyone.
And we're still accepting, user authorizations, and we will be ongoing.
Yeah.
But if you have interest in it, we require that the CEO identify people or the persons in their facility that are appropriate to have access to this PHI level data, and the CEO or their designee will authorize, and then we'll have the user sign an acknowledgement that they'll be accessing patient-level PHI, online and what's appropriate and what's not. So
and this is free, so this is part of it. So if this is something that your hospital wants, then just obviously all you got to do is get those access forms to us. All right, then we will move on to, and I'll stick with my screenshots and not try to go live on the website. But we have begun over the last several months, or actually probably the middle part of 2018, moving a lot of our data sources, resources over to the GHA website. And one of the tools that we or services that we provide to you are reports that are generated from DataGen, who is a subsidiary of the Hospital Association of New York State, Haney's. And we have subscribed to these reports on your behalf for some years now. They're cost model reports, and Bill's going to share with you kind of the benefit of these reports, and we'll also talk about a couple of webinars that are going to be made available to the state of Georgia for the hospitals, and the information on those. So, Bill?
Sure.
I hope all of you are on this distribution list. This is, like Leslie said, this is where we put, and the way we refer to it, these are not confidential reports from the terms of like PHI. We don't put anything related to the HIN program or anything that's, that deals with PHI or quality related stuff in these folders. But these are the places where we can generate individualized reports for the hospitals. The last update that we sent out was actually March 20th. So I hope you all got an email from me, and I think it was titled GDDS member folders or member reports updates. And it's just the normal GHA formatted email. And what we've done in there, there's really, 4 types of reports, or 3 folders in there, 4 if you count the economic impact report. There's finance, policy, and quality. And what we try to do is categorize each one of the reports that we get into some of those buckets. Now, you can kind of go back and forth on whether something that's related to Medicare readmission penalties is finance or quality, but generally speaking, if it deals with just pure reimbursement, it's finance. If it deals with policy modeling, we'll put it in that. And then if it relates to any of the quality-related measures, we throw it in those buckets. Then, each one of these, as you can see on the screen, that there's by hospital and there's by system. So if you're within a system, so the yellow arrow is kind of covering it, yeah. But if you were under Archibald Medical Center, you're going to have access to every one of the individual folders underneath there. Some of these reports we can aggregate up to the system level, and then some of them are individualized down to the individual hospital level. So where we can, we roll them back up. So the ones that we added then on the 20th of this year, of March were the 2019 enacted Medicare cuts analysis, wage data that's projected out for federal fiscal year 2020, Medicare spending per beneficiary, occupational mix data, outpatient claims analysis, which, some of these get kind of granular, but they're really cool if you want to start really digging into it. Uncompensated care analysis. The policy folder we put in the potential Medicare cuts analysis. So that's one of those things that if we've seen any politician anywhere dreaming up of a way of cutting Medicare, it's in that analysis. And then the last one we added was the quality programs. The 2 that are really popular in there right now are the enacted Medicare cuts analysis. This has proven to be a really popular tool, especially as folks are out in the community, showing the impact of all of the cuts that have occurred to Medicare since 2010. So when the ACA passed, it started back then, and then it projects all of those cuts out. So you can see it takes into account any sort of Medicare market basket updates or reductions, DISH, Medicaid DISH, sequestration, the coding cuts, any sort of the 340B reductions that have been in there. And the way to look at this is the green box is the legislative type of thing. So anything that was required in law are in the green buckets. The orange are more of the regulatory, and then the purple is the quality-related measures. So I don't know if it can be seen. I don't know if you put the other part in there, but the overall impact for Georgia since 2010 projected out all the way to 2018 is a loss of almost $17.4 billion. And you can see the orders of magnitude in there. So the ACA market basket cuts, that is averaging out to be $7.8 billion over those 18 years. And so each year it kind of goes up. So we can run this report, and we've done it at the individual level, but this is also one that we can aggregate up to the system level. So if your system CEO is out there doing the stump speech to the Rotary clubs, this is where they can really flash up there how much they're projecting to lose over those same time frames. So this one, again, is proven to be very popular. This is in the AHA packets that are going up next week to hopefully make some case to those legislators to, put the knives away. It's starting to add up to be real money now. Another one that we have that's real popular. I was about to say this is a 7-page report for really a 1-page takeaway. That first page is the meat of it. That's the real impact slide, and then the other 5, 6, 7 pages are all about the detail behind each one. So if you really want to kind of go in and start looking at where all of them came from, there's a big description there, and then it breaks down even further into the individual buckets and by year. So if you could look all the way through, in fact, I think the last page is the one. So that's the impact by year, and then the very next one I think is the impact by each one over the extended cuts and then the proposed cuts. So that's been a real big one for especially the C-level to go through. The other one that we've put in there, I think it's the quality program summary. Yep. This is the one that a lot of the quality folks like. This is a 1-pager that is the performance and impacts of each one of the CMS 3 inpatient quality programs. So you got your value-based purchasing numbers at the top, the readmission reduction program, and then the hospital-acquired condition reduction program. So each one of those, and this is, we've taken one just kind of as a sample for Georgia, and you can see the relative cuts, the annual impact of each one. So for this particular facility, the estimated annual impact it's actually falling. It was $185,000 to the good in the first year that they're projecting a loss basically from that 185 down to 85,000. So you can see the red and green arrows to kind of tell you what direction all of those measures are flowing through. It's been a consistent loss on the readmission side, and then the last one, it will show the summary and aggregate. So these are all updated. We send out probably an update every 2-3 weeks. So if you're not getting those emails, let us know. And if you won't, then you guys can almost be the quarterback to send it out through to the right person. I think we've put all C-level on here and anyone else that they've asked for. But as you can see, this is the CFOs are going to want to look at the policy and the finance folders, and the quality-related folks are going to want to look at the quality and probably even the finance to see some of these types of numbers in there as well. So hopefully you're getting those, and we want to send that out as often as we can. So generally speaking, we're sending out updates about 2 times a month. You want to talk through their webinars? So we, because we feel like these reports are so valuable, and our partner the people that generate these reports had offered, we have a monthly call with them, a national call with all the other subscribers, statewide subscribers, and they had offered to host webinars for each particular state just upon request. So we thought it would be a great idea and an opportunity for us to have a webinar, and they will specifically go through these reports based on, Georgia's data. So we hope to have a high number of participants. We're going to send out the invitation this week. There's one on Thursday, April the 25th. This will focus on Medicare's value-based purchasing program and analysis for Georgia hospitals, and that's just a screenshot of the report. And the second one is in May, on May the 22nd, and that one will focus on Medicare. Thank you. So those are 2 wonderful opportunities to be on a call and focus just on the Georgia data. So we hope if you're not the appropriate person to attend that webinar, you'll pass that along, but we will be sending that out to a multitude of people, not just folks that are in this user group. The other thing that we have put into the member folder is we are getting ready to publish our annual economic impact report. Yeah, that should be, this will be released on Monday. So as you can see, that we've got over 150,000 FTEs in Georgia hospitals, and through all of the various multipliers and actual spend, Georgia hospitals have a $54 billion impact on the economy. This is also proven to be one of our more popular ones. We will send this out. We'll send out a summary piece that's on top of this, as well as some other context data that you can use to kind of help explain it. GHA will send out a article to all of the statewide hospitals, kind of in the aggregate, but we'll also send out a press release that the hospitals can then use and fill in their own jobs reports and their own impact reports for their local community. One of the things that we added this year was a measure of the county jobs that have been supported by hospitals. We had some folks that were asking for basically additional context on what the jobs meant. So we were able to find a data source that had the total jobs in each county. So we took the number of jobs that the hospital provided plus what they supported to come up with a measure for how many of the jobs in each county were supported by the presence of a hospital. So we think that's going to be a very valuable add that's going to help really tell that story and add that impact punch. We always say hospitals tend to be the second largest employer in the community behind schools. Well, we were able to demonstrate in some communities where that is and how many jobs might potentially be lost if the hospital were to go away. So we have 104 Georgia counties have a hospital, and so those are the counties that will be reflected in here. But that's going to be released to the media on Monday and also to the membership on Monday in the member folders.
Here's just a snapshot in the economic impact report for the individual hospital. It consists of the hospital's information, their economic impact and community benefit, and then there is a page for the metropolitan service area, and then there's also a congressional district page. So the data is aggregated several different ways, and then if the hospital is part of a system, it's also aggregated at the system level into one large report. But each hospital will have their own individual hospital page, the MSA, the congressional district, and the state level, and then potentially the hospital system report. So that's what the annual economic impact report will consist of. There's also plenty of couple of pages of a report summary and footnotes and sourcing of how the data was gathered and calculated. So if you have any questions about that report, don't hesitate to give us a call about that. And again, those will be placed in the member folders on Monday. Any questions about the economic impact report or the Haney's reports? I kind of didn't stop to give you an opportunity to ask any questions. But these are all pieces of information that we're making available on the GHA website, again, in the member data folder. And if you don't have access to that, just give Sharifa a call and we'll help you get the appropriate authorization to gain access to that. Well, that is all we had for today. Are there any questions about anything else? Our next meeting is scheduled for May the 1st. I don't believe we should have a conflict with that meeting. Are there any questions about the data program, the strategic planning tool?
This is Dan Jones at St. Francis. This question may have been asked earlier, but can we get a copy of the presentation?
Yes, we are. That is one of our goals to be. I'll send it out today, but we will be posting these on on GHA's data services portal, and we're working to get the recordings on a YouTube channel so that those can be accessed as well. Next month's invitation should look a little bit different. We're going to be utilizing a different tool to send out mass emails through our new CRM system, so be on the lookout for that. It'll look a little bit different. It'll still be coming from me, but we'll have a little bit different look and feel to it. We're trying to do that because we get a lot of kickbacks. I know that sometimes mine goes to spam, and this is to hopefully alleviate some of those blocks on email. But I will send this PDF out to the attendees today. I'll get that attendee list.
And I am posting them on the website.
You are? Okay.
Yeah. So if anyone, I would encourage everyone to create a login on GHA.org, and that's how you'll be able to access the data services files.
Any other questions or comments?
Well, if there are no questions, then we'll give back some of your time and your day, and please don't hesitate to contact us if there's any questions, and be on the lookout Monday for an email about the economic impact reports and how to access your individual hospitals or systems reporting. So with that, there's our contact information. So like I said, please don't hesitate to reach out anytime for any questions that you may have.
Thanks, everyone. Enjoy the day.
Thank you.
Thank you.
Thank you.
Thank you.